name, but my favorite sign that day was this. It was a woman who had a sign that said, "I'm a Republican. I voted for Scott Walker, and I'm sorry." Ladies and gentlemen, brothers and sisters, 125 to 150,000 people came out that day. And let me leave you with the words, I'm leaving you with the words I gave to them. I will tell you what I told the people of Wisconsin that day. Brothers and sisters, we must unite. We must fight. We must take back workers' rights, because the people united will never be defeated. The people united will never be defeated. The people united will never be defeated. Say it, the people united will never be defeated. Thank you very much.
That was terrific, absolutely terrific. So, let me hear one more time who we are. We are! United! We are! One! We are! United! We are! One! We are! United! We are! One! Excellent. So brothers and sisters, Washington State used to be a leader in healthcare. Apple Health for kids, basic healthcare for working poor. But now we're slipping backwards, brothers and sisters. We have nearly 1 million folks in our state that don't have health care benefits at all. This is not right. So to talk about health care from a people's perspective, we've invited Sarah and Vicki McIntyre, a mother and daughter team from the Children's Alliance, and we've invited Julia Weinberg, the president of the Washington State Nurses Association and a registered nurse herself. So give them a great big welcome. Thank you.
My name is Sarah and I have asthma. The medicine I need costs a lot of money and I have had 2 major surgeries. Without Apple Health for Kids, it would have been too expensive for my family. Without Apple Health for Kids, I would not be here today. I think all kids deserve the opportunity for health coverage.
I'd just like to say this is why we're here, is to see our future leaders for the coming years. She's going to be one of the senators and representatives at one time. So we need to support the kids and support Apple Health for Kids and make sure they don't cut any other programs for kids, because these are our future leaders.
As I was introduced, my name is Julia Weinberg and I'm a registered nurse and the president of the Washington State Nurses Association. We are here for you. As a registered nurse, it is my job to provide direct patient care to patients and families, and I've been doing this for well over 25 years. I see every day firsthand the devastating effects of our unfunded health care system. You know, during this recession, the government has been chipping away at the health safety net while families in Washington are in more need than ever. Those critical programs like Apple Health, for which a previous speaker just spoke, maternity support services, the basic health plan, are on serious life support, and many programs have already been eliminated altogether. You know, corporations continue to get special tax breaks while working families struggle. More and more people are just one medical emergency away from the financial catastrophe. I know what happens when people are forced to put off care because they don't have access or can't afford to pay out of pocket. I recently saw a man who needed to have emergency surgery after a traumatic injury. When he woke from surgery, he had his mother both shared with me that he just didn't have any insurance and he'd be having to pay out of pocket.
He's good.
He asked me, please, don't give me anything more than I need for pain or anything else that wasn't absolutely needed. And even though his doctor recommended that he should stay in the hospital overnight, he said to me, I can't afford that. I don't have any insurance, and I don't have a job that isn't going to pay for a large expense like this. Surgery and a hospital stay? I don't think so. These are the kind of stories that I hear most shifts that I work, and I'm really not alone. As the Washington State Nurses Association president, I hear from nurses all across this state in all different kinds of settings and practices. Nearly every single one of us could tell you a heartbreaking story. Maybe each and every one of you have already had these kind of stories that you've lived through. We've hacked away at our health safety net, and we're putting vulnerable people like women, seniors, and children at risk. But make no mistake, we all will be affected. Public health districts and departments across the state have already imposed dangerous cuts that leave us all unprepared for those kind of disasters and very incapable of maintaining those critical services like immunizations for children, emergency preparedness, a communicable disease control for outbreaks like tuberculosis and the flu, and it's only going to get worse. These cuts are unsustainable. They jeopardize our future by looking for short-term cost savings. Programs that are proven successful and cost-effective are on the chopping block. Nurses, you know, are all about evidence-based practice, and those programs like Basic Health are really those kind of practices that prove that health care early on and prevention really save lives and save costs. The Maternity Support Services Program has had positive impact on 1 in 3 births in the state, over 30,000 births annually, and the program has proven to reduce low birth weight babies. We cannot afford to see these things be cut because it's only going to affect those young lives and the future of their health. Rather than argue about whether our health, education, or safety is most deserving of funding, we need to look at eliminating wasteful tax loopholes instead of simply slashing essential programs. We cannot afford to continue to balance the budget on the backs of working class families and expect our state to be healthy and competitive in the years to come. If we dismantle our healthcare infrastructure, it will devastate this state for years to come. Please join me and all of the nurses in Washington state in demanding that a budget that prioritizes people over tax breaks is what we need and want.
In good times and in bad times, it's clear education is not really a priority in Washington state. From early childhood education through college, our system has suffered and struggled for years. How will we get out of this recession if we don't invest in our children? If we don't invest in our young people? If we don't invest in adults who need additional training? Here to talk to us about the state of education in our state is middle school student Josefina Filipando. After her, we hear from Bernal Baca, former president of AFT Yakima and currently with the American Federation of Teachers Washington, and Kim Mead from the Washington Education Association and president of the Everett Association and National Education Association Director. Josefina!
Buenas tardes! My name is Josefina Mora Villalpando, and I'm a straight A student in middle school. And I was just accepted to I was recently accepted into the private school that I applied to, the Northwest School, and I'm very excited to go to high school. Without school, I wouldn't have gone as far as I have, but I wouldn't have made it if I wouldn't have tried to succeed either. Because the resources that are given to me and my fellow classmates are minimum, honestly, I very much dislike going to school. I don't think that anyone should not want to go to school. You want to go to learn and succeed and follow your dreams. The racism, sexism, lack of supplies, and poor quality of the curriculums that is given at school makes me think that I should even try to succeed. That school is like this because I, as a teenager, act like a kindergartner. I don't deserve to learn because my behavior prohibits me and my fellow classmates from learning. Or at least, that's what I'm told by my teachers. We can't afford to catch the education. Unless we want our children, our future, your future, to be discouraged from succeeding and from trying to pursue their dreams. Instead of trying to give the wealthy money, let's make the education system better for our future. Thank you.
Hello. This is a beautiful sight. I wish you could see it from here. It's absolutely beautiful. My name is Bernal Bach. I'm with the American Federation of Teachers Union. I want to ask you a question, as a teacher would ask. When was the last time you thanked an early childhood educator, a custodian, a maintenance worker, a food service worker, para-educators, higher education professional staff, university professors, and community college teachers? When was the last time you thanked them? I'm going to ask you now to thank them. Thank you, education people. If you haven't thanked them, you need to know that over the years they've endured huge budget cuts that have caused layoffs, furloughs, cuts in salaries, pensions, health care. All of this personnel cuts have direct impact on our students. And who are our students? Look around you today, working families. You are our students. Working families are our students. They're struggling to take care of the basics in their lives. And when they come to college, students end up paying increases in tuition. That is a tax, but they call it an increase in tuition. When was the last time anybody got a 38% increase in tax? That's what happened to the community college students. What about 48% at the universities? I ask you today, on behalf of the American Federation of Teachers, we extend our hand to all the union folks here and the brothers and sisters with working families, that we will continue to fight for social injustice and the eradication of poverty and racism. Thank you.
On behalf of the 82,000 members of the Washington Education Association, we are bus drivers, custodians, we have professors, we have school secretaries, nurses, teachers. We are the ones that help those students that are pre-K all the way through graduate school. In the last few years, we've watched our members start by losing their hours, then their jobs, and the devastation of losing their homes and their livelihood. We understood that at that time it was Wall Street, but what we understand today is that we are under attack like we've never been before, and that attack is on unions. We see this attack with our unions brothers and sisters in Alabama, Florida, Ohio, and of course our union brothers and sisters right in Wisconsin. What the people that are behind this attack are about is they don't like what we stand for. We stand for the right to be able to collectively bargain for our membership. And we stand for the people for tomorrow. So what they didn't count on was the fact that an injury to one, which we've heard already, is an injury to all. And the way that we're going to make the difference will be at the ballot box, because united, we stand as one. United, we stand as one. United, we stand as one. United, we stand as one.
Thank you, Olympia, Bernal, and Kim. So brothers and sisters, you know, the legislature, various bills are moving through the legislature. One that was just recently introduced by Senator Marilyn Chase and Representative Bob Hasagawa. I don't know if you've seen these posters out, but it's a big old bear claw, right? So when you pass a tax exemption in the state of Washington, and if the purpose is to create jobs, and then you don't create the jobs, we claw back those tax exemptions back to the state. Woo! Hasagawa's got a bill out there that would create a community investment bank, so we'd use our own tax dollars to leverage our own economy. Yay, Bob! Today we heard that there's going to be an attempt by the 11 freshman House members to introduce a bill that would close the interstate bank tax exemption. This one steals $100 million a year out of our state coffers. So look, what we know is the budget and its supporting revenue is a moral document. And to talk about this today, we are very, very honored to have the Reverend Dr. Leslie Braxton from the New Beginnings Christian Fellowship in Breton to speak to us. Give a big hand for the Reverend.